Hello, my name is Stephen Lightfoot and I'm the Chair of NHS Sussex. And what I'd like to do today is to give you a very brief summary of our board meeting on the 29th of May in Brighton. Now this was a little shorter than normal because it comes in the pre-election period, which means that like other public bodies, the NHS Sussex is not allowed to talk about future plans or strategies. And so we had to focus very much on assurance, oversight and any key operational decisions that needed to be made. So we started the meeting with our Chief Executive's report, which always provides a really good context for the meeting. And we talked very much around some of the organisational changes that we've been making in NHS Sussex to achieve our running cost reduction that we need to make from a national point of view. We also talked about some important system developments and also some assurance meetings, both with our providers, but also our own assurance meeting with NHS England, which went very well. Now we've got 5 board committees and each of the committee chairs took the opportunity to report back to the board on the assurance that they could provide. So our patient experience committee, for example, gave assurance on the new quality dashboard to ensure that the quality and safety of the services we provide in Sussex are really meeting the required standards. Our finance and performance committee gave assurance on the year-end financial result, which came out at just over £18 million deficit on something like a £4 billion expenditure. Now that's not quite where we wanted to be, but with all the challenges that we faced last year, I think that was a creditable performance. We then talked about our operational performance, and again that was probably a mixed bag if I'm honest. There were some areas that were very good and well above target, and there were some areas that were not. But I think one of the key things that came out of the board discussion was the need to actually have comparisons with other integrated care boards across England, so we can see where we're performing better or worse. But more importantly, so that we can learn from systems that are performing better than us. Our Workforce and Remuneration Committee gave a really important assurance around the new sexual safety in the healthcare workplace charter that NHS Sussex has signed up to, but also many other organisations have as well as some assurance around some of the appointment processes that have been going on. Our Population Outcomes Committee gave some really good, strong assurance around the vaccination programmes that we've been doing recently, but also some of the health inequality programmes, where there's a real commitment to really improve the health outcomes for our local population. And then our Audit and Risk Management Committee, they gave strong assurance on the end-of-year reporting processes that are ongoing at the moment. And they will all culminate in the publication of our annual report and accounts at the end of June. Now, from an operational point of view, one of the key areas of concern has always been around primary care access to general practice in particular. And over the last year, we've been working on an NHS Sussex primary care access recovery plan. And I'm really pleased to say there was some good progress to report. But I think it's also fair to say there's still more to do. We had to make some decisions around some important corporate governance documents, and some of those included, for example, some small improvements and small additions to the board membership, our board committee structure and our executive committee structure. We had to formally close down the board assurance framework for the last year, and we agreed the key risks and also the new format for the board assurance framework for the year 24-25. And then probably the topic that got the most discussion was one on organisational development. And after a really good debate, we took the opportunity to approve the new Commissioning for Improving Lives Together, which is a development programme for NHS Sussex to really reinforce and develop our role as a strategic commissioner in the system. So that's just a really brief summary of some of the key topics that we talked about at our meeting on the 29th of May. The next meeting will be held on the 26th of June over in Bognor Regis. So thank you very much for your interest and hope to see you next time.